Anterior total hip replacement precautions should strictly be followed for 3 months after surgery. You should check with your physician before foregoing them. Precaution number 1. Do not put your involved side into full hip extension. Walking with a normal stride length is okay since one does not fully extend with normal gait. Precaution number 2. Do not externally rotate the hip. This can happen while turning away from the involved side while walking or while reaching and turning away from the involved side. It is also not a good idea to perform repetitive hip flex or abduction in any position. So we can continue to make these free educational videos, please subscribe to our channel.